Hello everyone, welcome back once again and thank you for tuning in. So today we are going to look at something new apart from what we have been learning already, and that is patient care. The person presenting to you is by name Satyam Grace, and I'm so excited to have you and ready to take you through this session. So we are going to look at so many things under patient care, how you handle your patient, what are the things you need to put into consideration when you're handling your patient. So I want you to pay attention and give me all your ears so that we are ready to dive in. So the objectives of our study today. We need to know pharmacist-initiated therapy, and we are going to define it. What are the importance? What are the alignments? And this specific patient pharmacist-initiated therapy. And then what is the required knowledge for someone to participate in this or to carry out this activity? We shall also describe the steps in assessing clinical problems of a patient, acute and chronic patient care. We shall describe the options available for patient care and then explain how to evaluate prescription and non-prescription cases. Then we shall describe the information that we need to give to our patients and what are some of the information that you would give to your patient, and what is the information that a patient must get or walk out with. Okay. You excuse me a bit. I don't know, my keyboard is not responding. Sorry about that. Alright, so this is patient-initiated therapy we are talking about, and we said we need to describe it. So a pharmacist may prescribe medicines that are designated as a pharmacist's prescription drugs, as long as he or she has the required competence to do so. So the competence is based on a pharmacist's skill and a patient characteristics that a patient presents to a pharmacist. So a pharmacist is a person who has undergone training in different areas to become what they are or to attain that title of a pharmacist. So you find that this person has the competent skills to perform whatever they are required to perform. So what are the importance of patient-initiated therapy? We find that a dramatic increase in healthcare costs, and yet the pharmacist doesn't charge consultation fee. So when we look at what's happening on ground right now, we see that most people are like going to facilities and they are asked for a lot of money for consultation fee, and yet maybe it is a minor illness. So you find that a person feels overcharged with that specific amount of money, consultation fee. It's not bad to pay it, but you find that maybe the patient is not ready to pay that. And maybe the patient decides to walk to the pharmacy, and in a pharmacy they are not asked for this consultation fee. You find that they describe or explain whatever they are suffering from without paying the fee. So you find that this is like an advantageous to a patient in a way that they can be handled, they can seek advice without paying a consultation fee. So a greater awareness of professional services a pharmacist can offer, which has been boosted by the growing confidence in a pharmacist. There is also availability and accessibility of the pharmacist without the need for prior appointment. You don't have to make an appointment to meet a pharmacist. You find they are always available and ready to help. Confusion among its customers because of the availability on market. You find that most of the towns, most of the cities, most of the places have pharmacies almost every street. So you find that they find it more available and they can easily walk in with or without a prescription. A growing awareness of self-care for the patient by the patient. So a patient is aware of the self-care because of the trainings or health educations that health workers have given to the patient. So a pharmacist is an advisor of the public on everyday care, healthcare and medicine supplies. A pharmacist also is a key figure in supply and delivery of medications to the customers. So what are some of the alignments under pharmacist-initiated therapy? You find that there are limiting or self-limiting conditions that a pharmacist uh, handles, okay, and then are not regarded as a life-threatening conditions, do not normally give rise to serious complications, and can be recognized by the pharmacist with a high degree of certainty on the strength of history taking and observation. There must be adequate non-prescription medicines available on the market for effective treatment of these alignments. So what's the required knowledge? So you find that the required knowledge, you need to know what a patient has described to you, and you should be in position to define whatever they have presented. You need to know the etiology of that specific condition, and then the pathophysiology of what a patient has described to you. Then you should be in position to recognize, like recognition assessment of these conditions. How do you assess what a patient has presented to you, and then what are the complications and guidelines for referral in case of a complication? When do you feel it is time to refer the patient? Treatment and then precautions. So patient care therapeutics, we find that therapeutics itself is the art and science of healing. There are several options of healing a sick person. The option chosen by a particular patient is referred to as the mode of intervention. You cannot choose an option for healing before you assess the clinical presentation of a patient. So how do we assess for clinical assessment of this patient? What do we do when we are assessing the patient? The first step is to greet the patient, okay? So if a patient is conscious and can hear you, you have to greet the patient. The second step, it makes them a bit comfortable of the environment where they are in. Because if you just work on them without greeting them, they will feel insecure, yeah? So the first step you need to do is to greet the patient. The second step you have to do or put into consideration is to obtain a patient complaint on the patient's own words. What is that a patient is complaining about? Like, by doing so, you are taking a history of illness, and you inquire specifically about the main complaint and other related complaints that a patient can be talking about. So you may not need only information from a patient. For some cases, you can also or could also act on the information provided by a caregiver, okay, or a caretaker, yeah. So establish the duration of illness from the patient's own words. Next, you look at the signs, that is findings of the patient's physiologic examination. For example, their temperature, blood pressure, heart rate, and abnormalities in the systems affected. Okay, you could also carry out investigations like laboratory tests and X-ray if these facilities are available in your health facility. If you cannot manage this illness, kindly refer this patient to the next health unit. Do not handle what you cannot or what you're not trained to handle. Okay, a patient has come, maybe requires a surgery, and the pharmacist is not trained to carry out or to provide surgery. So it's not right for you to start. Yeah. So acute and chronic care. Some of the ways or some of the things that these patients are going to present with. So what is acute care? You find that acute care is concerned with a short-term or severe illness of brief duration. For example, you may have treatment of cold, sprain, hypersensitivity reactions, or allergic reactions, or maybe recovery from delivery of a baby. It is an acute care. Like what you're going to offer to this patient is acute. What about chronic? You find that that refers to long-term monitoring and treatment of ongoing diseases or disorders such as cerebral palsy, and then sickle cell anemia, diabetes, hypertension, and then you can have heart diseases and so many others. So without effective treatment, you need to know the state of your patient. Okay, so what are the options for patient care or mode of intervention? You need to give medications to your patient, counsel your patient, and other care providers. Okay, follow-up or monitoring of this patient has to you need to monitor always your patient for compliance and adherence, and then referring the patient in case the condition maybe you can't manage it, or maybe it is not improving. And then there is also need for you to combine medications. Okay, you combine a number of medications that you're giving the patient, as well as following and monitoring them, and then referring them to the nearby facility. So what about according to World Health Organization? What do they say about acute care? How should acute care be managed? So according to WHO, that is World Health Organization, integrated management for acute care, you have to do quick checks for emergency signs, and all of us know most of these emergency signs, and you assess acute illness and classify that illness, recommend for HIV testing, and then identify treatments that you're going to give the patient, treat the patient, advise and counsel this patient, prevention, whereby you do the screening and prophylaxis, and then follow-up care for acute illness. What are the principles of a good chronic care? You need to develop a treatment partnership with your patient. Focus on your patient's concerns and priorities. And then you use the 5 A's. 5 A's where you have assess, advise, agree, assist, and arrange. So assess the condition, advise the patient based on what you have assessed, agree with the patient, let the patient consent to whatever information you are giving them or to the treatment you are suggesting for them, and then assist the patient in following whatever treatment guideline you have chosen for them, and then arrange for maybe review, refill, something like that. So support this patient's self-management and then organize proactive follow-ups. You also need to involve expert patients, pre-educators, and support staff in your health facility. Okay, then link the patient to the community-based resources and support. Use written information registers, treatment plans, treatment cards, and written information for patients to document, monitor, and remind them. Okay, work as a clinical team. Don't work alone, because there are some like a health facility always works as a team. There are some other examinations that you may not be trained to do or have the skill to do, and you need to work as a team. Yeah, assure continuity of care. How do you evaluate the prescription and non-prescription cases? What do we mean by prescription and non-prescription cases? Because your patients are going to come with a prescription or without a prescription. And you need to be able to know this condition requires a prescription, and you need to send a patient to acquire one. Okay, so a prescription case is when a patient comes to you with a prescription from a clinician or a physician. All right, while a non-prescription case is when a patient comes to you without a prescription. How do you evaluate prescription and non-prescription cases? So the patient information is the one to guide you to grade whether this is a prescription case or a non-prescription case. So a prescription case must be evaluated for appropriateness to patient in terms of drug of choice, and then dosage form, and then dosage duration and absence of drug interaction, omission, and contraindications. And then when we look at the British National Formulary, is a useful source for all these issues. Okay, so useful patient drug information. The patient needs to know this information about the drugs they are taking. One is the name of the medication they are going to swallow. This is very crucial in case of adverse drug reactions or overdose of the medications. How much is to be taken? What's the dosage? What's the dose? Clearly explain the exact amount of drug to be taken each time. How often the drug should be taken. Clearly state how many times a day and how many hours apart the drug dose should be taken. And then how long the drug should be taken. What's the duration of this medication? Why they are taking the medication, what is the indication for why they are taking this medication. It helps the patient to understand the treatment and appreciate the treatment and encourages them to comply to treatment. When to take the medications. So we are continuing with the useful patient drug information. You find that how to take the medicine, use familiar and simpler language when explaining how to take, and what to avoid while on the medication or with medicines or taking medication. There are some foods, drugs, or other drugs that may interfere the absorption. Maybe, for example, oral contraceptives for female patients affects or effects of oral contraceptives may be reduced by a number of drugs such as antibiotics. So in case you are giving them antibiotics, also inquire whether they are swallowing oral contraceptives, okay? Because we know that the effectiveness of these oral contraceptives can be affected by some of these antibiotics. What are the side effects of the drug? Very crucial. When to stop taking the medication in case severe side effects and adverse drug reactions occur. What to do in case the medicine causes side effects. Stop treatment. Not to share the medicine with another patient. How to store the medicine, the patient needs to know this. To keep the medicine out of reach of children. That's it. So, in summary, you find that the crucial skill required in patient care are diagnosis. You should be in position to diagnose, dispensing, counseling, monitoring, and evaluation of your patient drug therapy outcomes. Thank you so much. We have come to the end. If you came this far listening to this specific lecture, thank you so much, and subscribe, like, and share to Grapham Academy for more lectures like this. I wish you all the best. Have a great time. Thank you.